Knowing how to properly check someone's vital signs is an important step in being able to determine if they might be having a medical emergency. Also, as we age, it's important to monitor those vital signs, paying closest attention to the blood pressure. Today I'm going to demonstrate for you how to check those vital signs, including the blood pressure, the pulse rate, and the oxygen saturations, and also what the normal ranges are for a healthy adult. The tools that you're going to need for this are a blood pressure cuff. These come in manual and automatic. This is a manual blood pressure cuff. You also need a stethoscope and a pulse oximeter. These can be picked up at most stores for about $20 to $30. To measure someone's blood pressure, you simply wrap the blood pressure cuff around their upper arm, making sure that the label is over their brachial artery, which runs on the inside of your bicep right there. At the end is a pump with a little dial. You want to make sure the dial is turned all the way clockwise so that it's tight. And then you begin inflating the cuff, watching the needle on the gauge go up, and the numbers go up to 300. You only want to inflate it to about between 180 and 200 should be sufficient. Once you get it inflated to there, using your stethoscope, you place it in your ears. Using the head of your stethoscope, you place it just below the blood pressure cuff, right there in the bend of your elbow. And while listening closely, you begin to slowly turn the dial counterclockwise and watch the needle begin to slowly move downward. At the point you begin to hear an audible pulse through your stethoscope, whatever number the needle points to, that will be your systolic, or the top number of your blood pressure. And that indicates the pressure inside your arteries while your heart is contracting. Continue to slowly deflate the cuff. The needle will continue moving downward. At the point you lose that audible pulse and are no longer able to hear it, wherever the needle points then, that will be your diastolic, or the bottom number of your blood pressure. And that is indicative of the pressure inside your arteries between beats, or while your heart is relaxed. And the average for a normal healthy adult for your blood pressure is about 120/80. And these numbers can vary about 20 points in either direction for either the top or the bottom number with minimal consequence. Next, checking someone's oxygen saturations using the pulse oximeter. You simply slide your finger in the end and push the button. It takes about 10 seconds. Your oxygen saturations are measured in a percentage. Normal percentage ranges for a healthy adult are between 95 and 100%. And what this is measuring is the percentage of oxygen that is attached to the hemoglobin in your bloodstream, which is indicative of how well your respiratory system is functioning. People who have asthma or COPD, you might see a little lower numbers on that. Or if it's below 95, it might be indication that they are having some type of respiratory illness. The pulse oximeter will also measure your pulse rate. Another way of measuring your pulse rate is by palpating your radial pulse. You have a radial artery that runs just on the inside of your wrist, just below your thumb. Using 2 fingers, you feel around until you feel the heartbeat in there. You want to count that. Use looking at a clock or a watch. You can count it for 30 seconds. At the end of those 30 seconds, you can double that number, and that will be your pulse rate in beats per minute, which is how it's measured. Normal ranges for a healthy adult on pulse rate is between 60 and 100. And those also can vary depending on exercise or physical activity. Anything in pulse rate above 150 might be something you might want to get checked out by a doctor. Today I have demonstrated for you how to check someone's vital signs as well as what the numbers mean, and I hope that you have a better understanding of what you're looking at, and if you ever find yourself in a situation where these numbers are needed, you will feel more confident in your ability to measure them.